Hi, good afternoon. Today I am going to present a topic of antacids. The antacids mostly commonly used for the pharmaceutical preparations. For what purpose? For what uses means for treating the acidity related disorders. Okay, we have to discuss the topics. In antacids, in what are the contents are available means first one is we are going to discussion about introductions. Second one is classifications. Third one is mechanism of antacids. Fourth one is side effects. Fifth one is combinations of antacids. Now first we have to discussion about introductions of antacids. First one is acidity. Acidity is also referred to as acid reflux. It is a common medical condition caused due to excessive productions of acids by the stomachs, which flows back into the food pipe. Okay, and causes pain or burning sensation in the lower chest area. First, let us understand what the antacids. Suppose antacids is a one of the substance. It will be neutralize the excess acid in the stomach. It the provide relief from symptoms from such as the heartburn, indigestion, and gastric irritations. Thus, if suppose antacids we have used means we are relief getting from heartburn, indigestions, and gastric irritations. Next one is antacids. Anti means it will be meaning against. Acidus means it will be meaning acids. They are weak alkaline compounds. Okay, used to neutralize hydrochloric acid in the stomach. Antacids almost it will be neutralize the HCl acid. Already HCl acid will be secreted from the stomach. Antacid, suppose we will use to antacid means it will be neutralize the acid in the stomach. Next one is antacids are the substance which reduce the gastric acidity, resulting is an increase in the pH of the stomach and duodenum. Suppose we are used to antacids means it will be reduce the gastric acidity. It is resulting the suppose increase in the pH of the in stomach. There will be increase the pH and duodenum. Okay. Next one is gastric acidities. It will be occurs due to excessive secretion of HCl in stomachs due to various reasons. Gastric acids is secreted from parietal cells. Where the gastric acid will be secreted? The gastric acid will be secreted from parietal cells. Stimulated by when stimulated by vagus nerve, histamines, and hastings. Okay, suppose vagus nerve, histamines, and hastings. Suppose it will be stimulate means the gastric acid will be secreted from parietal cells. Okay, it may be suppose the stomach normally produces on the HCLs. We know all the stomach will be normally produce HCLs, which helps in indigestion. Okay, however, excess acid production may cause discomfort ulcers and gastroesophageal reflux disease. These conditions also known as means other name is GERD. Okay, antacid help by the reducing the acidity of gastric maybe contents. Okay. Next one is the pH of the stomach pH. The pH of the stomach is 1.5 to 2.5 when empty and rises to 5 to 6 when food is ingested. Okay, suppose in empty stomachs we have means the pH level it should be 1.5 to 2.5. After food we will take means the pH level is 5 to 6. Okay, low pH is due to presence of endogenous HCl's which is always present under physiological conditions. Okay, when hyperacidity occurs, the result can range from suppose hyperacidity occurs from where means the results from gastritis. Suppose gastritis is presence means at that time hyperacidity will be occur. Next one is peptic ulcers or esophageal ulcers. Next one is gastric ulcers in stomach. Next one is duodenum ulcers. Next one is, this picture was the stomach pictures. This tube will be means this part of we will have the name was esophagus. In the food will come from esophagus after the will entering in the stomach. Okay, this one is the stomach. After one is the inside. This side means the different color was there. In this side the acid will be secreted. That time the food will be not taken properly means that time ulcer will be occur. The in stomach the ulcers will be occur means this part of the ulcer is name is was gastric ulcers. Next one is it will go after stomach, it will go first one is small intestines. This area was the small intestines. Suppose in small intestines the ulcer will be occur, the name was duodenal ulcers. Okay. Next one, what are the criteria of the antacids preparations? Okay, the antacids should not be absorbable. Okay, next one is the antacids should not be laxatives. The antacids should antacids affect rapidly. Okay, the antacids should buffer the pH range is 4 to 6. The reactions of antacids with gastric HCl acid should not cause a larger elevation of gas. The antacids should probably give Pepsi. Next one is that classifications. Antacids mostly are classified into two types according the chemical composition. First one is systemic. Second one is non-systemic. Systemic antacid, first one is absorbable antacid. Other name is absorbable. Non-systemic is other name is non-absorbable. Now we are going to systemic absorbable antacids. In that the first step is systemic, and this example is sodium bicarbonate. The antacids mostly are absorbed into the where from absorbed means bloodstreams and provide rapid relief, but prolonged use make us alkalosis and other side effects. Suppose we have prolonged use means systemic absorption means there will be occur the alkalosis, maybe that side effect will be occur. Example was sodium bicarbonate. Next one is non-systemic. Non-systemic is non-absorbable antacids. In that antacids, they are compounds that are not absorbed into the systemic circulations. Okay, and their anionic group neutralizes the hydrogen ions in acetic acids. This release the cationic group which is combines with bicarbonate from the pancreas. Okay, to form a insoluble basic compounds that is secreted in the fecus. These agents do not produce metabolic alkalosis. Examples of non-systemic antacids means first one is aluminum hydroxide, magnesium hydroxide. Next one is calcium carbonate. Okay. Finally, thank you. In conclusions, antacids may play an important role in managing the acid-related gastrointestinal disorders, and for what purpose means improving the patient comfort. Okay. Thank you.